Atopic dermatitis is a common skin condition that can be characterized by itching and a rash. It affects 1 in every 6 children, and it can be treated. In the next few minutes, we'll explain what atopic dermatitis is and who suffers from it. We'll also provide some tips for preventing and treating it. A child with atopic dermatitis suffers from itchy skin, which often disrupts sleep and causes lethargy and difficulties concentrating. Lack of sleep and discomfort can affect the child's ability to function at school, lower the child's self-esteem, and even cause anxiety or depression. Fatigue affects parents and other family members too, and can impact their mood and ability to work. As a result, it's important to address the rash and itch through regular daily treatment so that your child feels better both physically and emotionally. The good news is that it's actually pretty simple to treat atopic dermatitis and help your child. Let's dive in. The skin that surrounds and protects the human body has 3 layers. The upper layer, or the protective layer, is called the epidermis. Below is the middle layer, which holds the connective tissue and is called the dermis. And finally, there's the lower fatty layer, the subcutaneous layer. The epidermis is renewed continually. New skin cells are born every day, then they age and peel off. Before they separate from our skin, these cells act as a barrier. They serve as a protective layer that safeguards our skin from the outside world, keeping contaminants and allergens out while locking moisture in. With atopic skin, the barrier does not function properly and behaves as if it is cracked. Moisture evaporates through the cracks and inflammation develops. This is known as atopic dermatitis. Bacteria and allergens can penetrate the skin through the cracks, making the inflammation worse. With time, the epidermis usually matures and the cracks will close up. This means that for most children, atopic dermatitis will improve with time. But until then, their skin needs our help. What can we do to help? The treatment of atopic dermatitis is based on the frequent application of moisturizer. In order to restore the skin's function as a barrier, moisturizer must be applied regularly, several times a day. It's important to choose the right kind of moisturizer. Make sure the cream is thick and slightly greasy. Avoid creams with ingredients like perfume and SLS, sodium lauryl sulfate, which can irritate sensitive skin. Once you have the right moisturizer, you'll want to apply it so that it retains the moisture in the skin in the best possible way. The best time to apply moisturizer is immediately after bathing, so that it locks the moisture in. Because moisturizer wears off after some time, it should be reapplied frequently throughout the day. Bathing can be helpful or harmful, depending on how it is done. Be sure to practice the following for baths. Keep baths short and bathe your child just once a day. Use a mild soap or bath oil that does not dry the skin. Avoid using a sponge, loofah, or brush, as they can cause inflamed skin to become even more irritated. Bathing once a day helps to wash bacteria off the skin. During bath time, the skin is soaked with water. By applying moisturizer immediately after the bath, within 3 minutes, the barrier is restored and the water from the bath is locked into the skin and the inflammation is decreased. Be sure to apply moisturizer generously and spread it all over your child's body and face. Besides bathing and moisturizing, there are a few other things you can do to care for your child's skin and reduce the itching, irritation, and discomfort caused by atopic dermatitis. Avoid hot and sweaty environments. Heat can irritate the skin and increase itching. Dress your child in light, loose clothing to avoid overheating. At night, cover your child using a light blanket. On hot days, stay inside in the air conditioning. Although food allergies seem to be common among children with atopic dermatitis, allergies and other food sensitivities or intolerances do not usually worsen their skin condition. Still, even when you follow the guidelines we've discussed strictly, flare-ups of itching and the rash may occur. When this happens, there are additional treatments that may be helpful. Topical steroids are very effective and safe for use under medical supervision. Be sure to tailor the strength of the ointment to the area being treated. Use a lower concentration on your child's face and body folds or creases. Apply the steroid ointment once or twice a day on the inflamed areas until you see an improvement. With proper medical follow-up, this has proven to be a very safe and effective form of treatment. A common mistake parents make is not applying enough steroid ointment, therefore not getting the full benefit of the treatment. Additionally, there are some anti-inflammatory ointments that do not contain steroids and may be a better fit for your child. Consult your doctor to find the appropriate treatment. For patients with recurring outbreaks, preventative treatment using steroids or other anti-inflammatory ointments can be used once or twice a week. Wet dressings can also be used to significantly reduce itching. In most severe cases, light, phototherapy, or oral or subcutaneous medications may be used to treat and heal the skin. Oral steroids are not suitable for treatment for atopic dermatitis. Because of the defective barrier, atopic skin is more prone to infections caused by bacteria and viruses. Bacterial infections can be treated using topical or oral antibiotics. If your child experiences frequent bacterial infections, you can treat them using disinfecting baths. Be sure to consult your dermatologist regarding this type of treatment. To summarize, atopic dermatitis improves in most children as they grow up. Until then, to prevent unnecessary discomfort and to enable a normal daily routine, adopt the following practices. Give your child a short bath once a day. Apply moisturizer that is suitable for atopic dermatitis immediately after bathing and reapply regularly. Keep your child cool during the day by keeping them inside and dressing them in light, loose clothing. At night, use light blankets only. Don't be afraid of applying topical steroid ointments. They are a safe and effective treatment when used with supervision from your doctor. Treat bacterial infections using antibiotics and consider bathing your child using a diluted disinfectant. For more serious cases, consult with your doctor and ask about other treatments. Save this video and watch it from time to time. We know it's hard to take it all in at once. And smile. In most cases, it gets better.